Hi, my name is Amber Terhune. I'm the health educator for the Johnson County Health Department. This presentation is about scabies. Scabies is a skin infection caused by the microscopic Sarcoptes scabii mites. The mites burrow under the outer layers of skin to live and feed and lay eggs. An infected person may have about 10 to 15 mites on their body at a time. Someone with crusted or Norwegian scabies has a severe form and may have up to 2 million mites on them. The life cycle of the scabies mite occurs in 4 stages: egg, larva, nymph, and adult. Females deposit 2 to 3 eggs per day in burrows. Eggs hatch in 3 to 4 days, then the larvae go to the skin surface and create small burrows called molting pouches. The larvae molt into nymphs within the molting pouches. Males penetrate the molting pouches of the female to mate. After mating occurs once, the female is fertile for the rest of her life, which is 1 to 2 months. The female leaves the pouch to find a place to burrow. She remains in the new burrow and lays eggs daily, lengthening the burrow as she goes. Male mites make temporary shallow areas in the skin to feed until they find a female to mate. Someone can spread scabies before they are even symptomatic. Scabies is very contagious, especially if someone has crusted or Norwegian scabies, because the mites can fall off with the crusts. It may be spread directly through prolonged skin-to-skin contact, which is often through sexual contact in adults. It is unlikely to spread through quick contact unless it is crusted scabies. The scabies mites cannot fly or jump. Indirect spread may be done through bedding, towels, clothes, and furniture, and this is more common with crusted scabies. Scabies is not spread by pets. There is a different kind of mite that causes dog and cat scabies, which cannot reproduce on human skin. If someone has not had scabies before, symptoms may appear 2 to 8 weeks after exposure. However, if someone has previously had scabies, symptoms appear about 1 to 4 days after exposure. Symptoms are caused by the allergic reaction to mites, eggs, and fecal matter, and may include severe itching, which is more common at night, and a rash, which may look like hives, small bites, pimples, or may be scaly. It may appear as burrows or lines under the skin, which may be grayish-white or skin-colored. You may develop sores from scratching, which may then become infected. With Norwegian or crusted scabies, there are thick crusts on the skin full of mites and eggs, which crumble easily. Scabies mites may be found anywhere on the body, but they are often found between fingers, in the folds of the wrist, elbow, and knee, in the armpits, around the waistline and navel, in the buttocks, breasts, or genitals, and in infants and younger children on the head, neck, face, palms, and soles of feet. Anyone can get scabies, regardless of race, cleanliness, or socioeconomic status. Those at higher risk for scabies are household or sexual contacts with someone who is infected, and those who live or work in places where there is frequent skin-to-skin contact, such as nursing homes, assisted living and extended care facilities, hospitals, child care settings, jails and prisons, homes for the developmentally disabled, and college dorms. Those at higher risk for crusted or Norwegian scabies are elderly, those who are immunocompromised, or disabled. Diagnosis is usually based on a physical examination from the presence of symptoms, rash, mites, eggs, and fecal matter. A physician may wish to confirm the diagnosis by removing a mite from the end of the burrow with a needle tip or collecting skin scrapings from affected areas to look for mites, eggs, or fecal matter under a microscope. Someone, however, may still be infested even if these are not found. Scabies does not go away on its own, and there are no approved over-the-counter medications available. You may be given a prescription lotion or cream, known as a scabicide, to kill the mites, and some may kill the eggs. Be sure to take it as prescribed and apply it to clean, dry skin. Most often, it is applied on the entire body from the neck down. Be sure to get in between creases and around the nails. Infants and young children often need treatment on their entire head and neck. Leave the lotion or cream on the skin for 8 to 14 hours, then wash it off and put on clean clothes. This is usually done at bedtime and washed off in the morning. Prescribed medications may include 5% permethrin cream or Elamite. This is the most common treatment. It is approved for all people 2 months of age and older, including pregnant women. 2 or more applications about 1 week apart may be necessary. 10% crotamycin cream or lotion, or Urax or Croton, is an approved treatment for adults. However, frequent treatment failure has been reported. 25% benzyl benzoate lotion may be used for crusted scabies as an alternative to permethrin. 5 to 10% sulfur ointment is approved for use in all ages if other treatments did not work. 1% lindane lotion is only recommended if someone cannot tolerate other treatments or other treatments did not work. However, it is not approved for infants, children, elderly, people with seizure disorders, women who are pregnant or nursing, or for those who weigh under 110 pounds. An oral medication, known as ivermectin or stromectol, is approved for worm infestations but may be used off-label for scabies. It may be used with widespread or crusted scabies, immunocompromised, and for those who did not respond to prescription creams and lotions. It is not recommended for pregnant or nursing women or for children weighing less than 33 pounds. It should be used along with a topical agent for crusted scabies. A person may need retreated if there are new burrows or rashes appearing. Retreatment is often needed with Norwegian scabies. It is normal for someone to have itching for 2 to 3 weeks after treatment, but that does not mean that they are still infested. Talk to your doctor if you still have symptoms 4 weeks after treatment. Household and close contacts with direct skin-to-skin contact of someone with scabies within the last month before the rash should be treated with medication at the same time, even if they are not symptomatic, to prevent the spread and return of scabies. They must also be prescribed a medication from a physician. You can usually return to school or work 24 hours after starting treatment. Do not treat pets. Other medications that may be used include antihistamines, anti-itch lotions, or a cool skin soak for itch relief, an antibiotic for any secondary bacterial infections, steroid creams for itching and swelling, or a keratolytic cream may be used for Norwegian scabies to help reduce skin crusts and help with the absorption of topical agents. Environmental treatment should be performed at the same time as medical treatment. Be sure to clean any items used or worn within the last 3 days by the person infected with scabies. You may hot wash and hot dry clothes, towels, bedding, hats, and pillows on the hottest settings. You may dry clean any items that cannot be washed. You may seal in a plastic bag for at least 72 hours any items that cannot be washed or dry cleaned. Mites can only live about 2 to 3 days off of a human. Be sure to vacuum the entire home, including rugs, furniture, and mattresses, and thoroughly clean out the vacuum. It is not recommended to use any insecticide sprays or fumigants. To prevent getting scabies, be sure to avoid direct skin-to-skin contact with someone who is infested. Also avoid contact with any unwashed clothing, bedding, towels, or etc. of someone with scabies. If you are at risk for getting scabies, get treatment at the same time as that person. Perform environmental cleanup as previously stated, including the hot wash and hot dry, dry cleaning, or sealing items in plastic bags. In institutional care, screen new long-term care patients and staff for scabies. Isolate any infected patients. Limit visitation. Use personal protective equipment, such as gowns and gloves, to avoid any direct skin-to-skin contact when caring for someone with scabies. And you may assign personnel to only care for those with scabies to prevent the spread to others. This concludes the scabies presentation. You may visit any of these websites for further information, or you can follow up with your physician with any questions or concerns. Thank you.